Hello, everyone. Um, I'm going to start our webinar, and it looks like we are getting almost everyone joining. To start, I want to make sure before we start our presentation, everyone knows what to do with the how that raffle works and what to do. So if you have not filled out the health questionnaire before, please go ahead and go to our website, mexicobariatriccenter.com/health-questionnaire and fill out the form. If you're doing it fresh, please select Dr. Miguel Montalvo. If you have submitted the form before or you're approved or whatever else, you don't have to resubmit the HQ. Just let us know to switch you. So the way you qualify to enter our raffle is to be able to get your HQ approved with Dr. Montalvo and watch the webinar all the way to the end when we actually do the raffle for $2,000 off of your surgery package. So, and okay, so I want to welcome everyone to our monthly webinar, informational webinar about getting bariatric surgery in Mexico with Mexico Bariatric Center. Topic of our webinar has been for almost 2 years now, collision of two pandemics, which is COVID-19 and obesity. Basically, COVID-19 shed a new light on obesity and its related underlying medical conditions. And that's why we are talking about the collision of the two pandemics. So today, it's myself. I'm the CEO and founder of Mexico Bariatric Center, MBC, and Dr. Miguel Montalvo is joining me. I have a pleasure to have him with me from our hospital in Tijuana, Mexico. So thank you so much for joining us and taking time, Dr. Montalvo. So like I said, if you have not submitted a health questionnaire, do so and select Dr. Montalvo. Otherwise, well, you're fine. You don't have to resubmit the form. We're trying to answer all the questions that are frequently asked. But if you have questions that we're not covering, wait until the end of the presentation and enter it in the tab that it says Q&A tab on your screen, and we will get to it. The topics that we are covering today is pretty much obesity and its risk, undergoing weight loss surgery in Mexico, what we do at MBC, and about the Mexico Bariatric Center company. And then Dr. Montalvo is going to take over and talk about all the bariatric options that we offer. And once we go over that, we are opening for question and answers. That's when we are getting to your questions that you put in the Q&A tab. And at the end, we are going to do the $2,000 off of surgery package raffle. So obesity is a pandemic, is a global epidemic, and is a chronic disease that is growing worldwide, including US. Human beings is not comfortable or is not accustomed to high calories in the, this era of food, we are lacking physical activity, and our body doesn't know what to do with sugary drinks and processed food. So our body has no defense against all these parameters. And of course, our genetics, our environmental exposure, our developmental history, these are all factors that is all adding up to the problem that is exposing us to being overweight and obese. Basically, once we gain weight, our fat cells, which is also called adipose tissues, the fat cells are altered. They increase in size, they change the structure, and they increase in numbers as well. So 3 ways is changing. And if you look at the graph, those 2 figures on my right side of my screen, you see that on the lower part, you see a lean fat cell or lean adipose tissue. And on the top, you see an obese adipose tissue. You see how the structure is changed and the size is changed. So as a result of the fat cell change, so it's not like, oh, when we gain weight, our fat cells just get bigger. No, the structure change. As a result of structural changes, our body is not going to be sensitive to insulin. That's why you get diabetes type 2. Your body is not sensitive to leptin. That's why you don't feel full when you eat, and you have to eat more. You don't respond to therapies and medications. Even vaccination is not as effective. So the obesity is just, is a matter of how much body fat we have. And to simplify it, they came up with this body mass index, which we call BMI. And when your BMI is normal, you're like your BMI is less than 25. When your BMI starts to go in between 25 and 30, now you're in the overweight zone. And after that, you are starting to go to the obesity. And after 40, you were morbidly obese, and then super obese. And of course, it just gets worse and worse. Of course, every individual is different. How much fat we carry in our tummies or stomach, those are all factors. But as a general indication, they use BMI. Our company offers procedures for BMI of more than 30. Of course, the surgical procedures. At some occasions, some of our doctors do take BMIs of less than 30, which is 28 or 29, depends on whether you have comorbidities or not. But as a general rule of thumb, BMI of 30 is our cutoff. And then we also, for age, we go down to maybe 16, again, case by case. And then we go to 62 or 65, again, case by case. That's why we want you to do the HQ so we can qualify you. Obesity is impacting 40% of adults in the US alone. Like we said, it has major risk factors. So I like to play this video real quick to show what happens when we gain where we gain weight and we gain fat. Oops, it doesn't have.
Fat in the abdomen can push on the diaphragm, limiting how much
Sorry,
air.
I have to do it again because the voice was.
Look at this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So, as you see, that's one of the consequences of gaining weight. You know, we are already went over what happens when the fat cells structure change, or their numbers change, or their size change. Of course, you know, everyone knows heart disease, stroke, diabetes, type 2, lung disease, impaired immune system, blood clots. You know, these are all. And then, of course, these conditions or underlying medical conditions got exposed even worse when COVID came. So COVID virus gets attached to the protein cells, proteins in the fat cells, and the more fat cells you have more breeding ground for COVID to get attached to. Talking about COVID, obese people are 113% more likely to go to the hospital after getting exposed to COVID, 74% more likely to end up in ICU, and 48% more likely to die. Of course, the pandemic shutdown did not help, and got probably the problem worse, but it also made some people realize how important it is to lose weight. We see actually more patients are trying to find solutions, surgical solution, other solutions to lose weight and become healthy and have a healthy lifestyle. So what's the cure for obesity? Of course, you know, medication, diet, and exercise are the one that everyone tries, but it doesn't work for everyone. It doesn't have a proven long-term solution to cure obesity. And bariatrics is really a miracle, has become a great tool for people to quickly lose weight. And it's a safe way to lose weight and is a long-term solution. I said miracle. This explains this 3 figures on my right side. It shows how is it a miracle. Okay, so when you do surgical treatment of obesity, which is weight loss surgery, you reset your body's thermostat, which is the way your brain and your gut hormones interact. So let's say in the individual in red, which is number 1, this individual weighs 250 pounds and his brain and gut hormones are used to interact at this weight and is comfortable at that weight. If this individual goes on an extreme diet and extreme exercise, we're talking about boot camp type of exercise, and lose 75 pounds. And so the body is going to react by lowering his metabolism and making him more hungry to bring him back to that 250, because the brain still sees you at 250. Now, if you did a surgical treatment, right away, your brain is going to see you at 175 pounds, which is the guy in the green, which is the third one. And what's going to happen is you're not going to get as hungry and your metabolism goes up, which means it's going to burn all the fat. So that's why you don't get hungry as much and your fat gets burned really fast and maintains it like that. People who do not have insurance or their insurance doesn't cover bariatric surgery, or it does cover, but the criteria, to meet the criteria and the deductibles are so high and so hard, they always look into medical tourism, which means going to a different country to get the treatment. Mexico has, Tijuana especially, has established itself worldwide as the center for weight loss surgery. Of course, Mexico Bariatric Center has been the forefront of this battle against obesity. And we are a US corporation that our office is in Sacramento. And we have been committed to offer quality weight loss surgery procedures in Mexico. And we have a track record that is very easy to find out. If you go online, you see our reviews, you see our patients, you see our presence. I've been in the medical tourism industry myself about 15 years. MBC got started almost 10 years ago. So in October, we'll be celebrating 10 years of MBC being in business. We have performed 18,000 successful surgeries, and we work with the 7 top surgeons in Mexico. Our process are very easy. We just have you do the HQ, like I said, and we get your approval. Once you get approved, then you put the deposit. You could do actually all this, very easy online. You pay the deposit. Now we can put you on the calendar, and you go about arranging for your travel, whether you fly or drive, and we do all the nutrition consultant, all that stuff. As I mentioned, our all-inclusive packages covers the surgeon fees, the hotel fees, the hospital fees, pre-op, post-op tests, medications, the hospital fees, nutrition support, aftercare support, and of course, transportation. And, it's easy to procrastinate and just say, I do this tomorrow, but honestly, this is the best time to go do it right now. So coronavirus, COVID-19 actually made our company stronger. We pulled through and we put some measures in place that, for safety of patients, well-being of patients, well-being of our staff, well-being of surgical teams, and our office is stronger than ever, and we just pull through stronger. One of our pluses, huge pluses actually, we have a lot of pluses that patients can enjoy just going with our company. One of the pluses is our support group. We do have 2 support groups. One is for past patients and one is for like transition, the ones that are still not quite ready to go. The main one has over 10,000 patients. These are patients that share their experience, their before after pictures, and you can actually interact with all of them, and they're there to help you go through and be successful. You know, you see on my right side of the screen, people keep asking, you know, any experience with women traveling alone, for example, and they all gonna have to, they're all pitching like, oh, look, it's all safe, you know. Remember, over 50% of our patients come by themselves. You know, MBC has layers and layers of support. These are our past patients, or we call them patient advocates. Sarita, Judy, Rena, Kelly, these guys are out there on Facebook, on the phone, supporting patients to get them through what they went through and get to where they are. So they actually started a podcast out of Georgia, and I recommend you join to that podcast. So basically, is once you do the paperwork, now you're ready to fly or drive to San Diego. Our driver is going to be there to catch you. You know, San Diego Airport is a rather small and friendly airport, even though if you, so there are two terminals. Terminal 1 is for Southwest, and Terminal 2 has all the Delta, American Airline, and United. However, they are renovating Terminal 1, is actually a mess. I just came back yesterday, and so yeah, but we know what airline you come in, what time you come in. Our driver is pretty much ready for pick you up. All you have to do is get your luggage and walk out and tell the driver which letter on the curb you are in, and you get picked up. We want you to come before 12 noon, and we want you to arrange for your departure to be 2 p.m., 1, 2, or after 2. Of course, if it's after 2, your wait going to be longer to get on your flight. If you do have a long flight back home, we recommend maybe you stay longer in Tijuana or San Diego. And also we recommend that you get up and walk around, you know, every hour or so, and wear the compression socks. Again, for people who joined a little later, if you have not done the health questionnaire, go on MexicoBariatricCenter.com and select Dr. Miguel Montalvo. If you have submitted your HQ before, whatever the you know, the stage you are in, it won't matter, which we can switch you. And make sure you watch our webinar to the end. Talking about exclusive network of best bariatric surgeons in Mexico. This is a dream team. We got Dr. Montalvo, which is with me today, Dr. Luisiana Valenzuela, Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Osana, and Jesus Ceja. I mean, you can't ask for better surgeons. So this is how your health questionnaire gets processed. Patients submitted online. It goes through our surgeon liaison. She's a bilingual medical doctor, but we just call her a surgeon liaison. She looks over every HQ comes in and makes sure it gets to the right surgeon for the right procedure. And then it goes to the surgeon. surgeon reviews it, responds back, and still surgeon liaison is controlling all that flow. At this point, we're working with the Me Doctor Hospital, and we are actually working to go to a new center that should be probably a few more months. We are using Hyatt Place, which is an enjoyable place to stay. I was just in the lobby yesterday and the day before, and it's such a joy to hang out there. And of course, the patients get their broth and popsicle and jello, and they can hang out with their companion, or if they came alone, they just hang out down in the lobby. We also use Fairfield Marriott, and when is extreme, there are some events coming to Tijuana that if we have to, we use Ibis Hotel, which is kind of a nice little cute place. So when you arrive, we do the pre-op tests, and you go to the hotel, you relax, and you're ready, rested for the next day to go through the surgery. We get you in the hospital at the time of your surgery, you do your surgery, and you're ready to go back home. We keep you pretty much 1, 2, 3 nights in the hospital, depends on what procedure you get. If you get endoscopic surgeries like gastric balloon, endoscopic sleeve surgery, we pretty much keep you 1 night in the hospital. If it's a sleeve or bypass or duodenal switch, we keep you 2 to 3 nights as needed. We do the tests, leak tests, and after that, we're ready to go home. One of the reasons for our success and low complications and high patient's outcome is the surgeon's load management, which we call. So we have 7 teams of surgery, and we load them every day at 3 to 4, maybe 5 surgeries, depends on the complexity of the surgery. And we keep that load even throughout the week. We don't load them up one day and not have anything the next day to do. So we try to manage their load. And this is one of the reasons our complication rates are less than 1%. So we talked about diet and exercise. So diet and exercise is something that a lot of people do. And then some people choose to take medication. And then it comes endoscopic procedures, like I mentioned, gastric balloon and ESG, which is endoscopic gastroplasty. And then it becomes the bariatric surgery, which is actually a surgery. And they rearrange or they cut your stomach, which is gastric sleeve, bypass, and duodenal switch. So the laparoscopic options, which is surgical options, or gastric band, we pretty much don't do any gastric banding because the gastric banding is proven to be problematic. So basically VSG is the most popular procedure we do. Mini gastric sleeve, very limited. Those are for really low BMI. We do single incision gastric sleeve. These are for patients that are BMI is lower, about maybe 30 to 40. And then of course the arm-wide gastric bypass, mini bypass, duodenal switch, single incision duodenal switch, which is we call SADI, and a lot of various laparoscopic revisional surgeries like old bypasses or bands to sleeve. And we also, sometimes if needed, we can do reversal of the bypass. As far as endoscopic procedures, we do gastric balloon, endoscopic sleeve gastrectomy, and endoscopic bypass revision, which we tighten the pouch if it's enlarged in the bypass, and we call it TORE, T-O-R-E. So this is pretty much the schedule for who qualifies with what surgery. As you see, endoscopic procedures are more for lower BMI. You know, if your BMI is 28 to maybe 35, gastric balloon is a good one. But again, you know, with the balloon, and you don't change so much the body's thermostat, you just basically create restriction, and it requires a lot of lifestyle changes. Dr. Miguel Montalvo is a highly educated, skilled surgeon that we have a pleasure to work with. He has an extremely qualified team that he works with. And I mean, he has done well over 2,000. This is old information. And like I said, he's very educated, and I'm going to let him introduce himself, take over, and go over all the procedures. Thank you, Dr. Montalvo.
Hi, hello, good morning to everyone. Let's talk about the procedures that we do here at Mexico Bariatric Center. One of the most popular procedures is the gastric sleeve surgery. In the gastric sleeve surgery, we remove approximately like the 80-85% of the stomach using 1 to 5 tiny incisions. These tiny incisions is like 5 millimeters, or only one of 10 millimeters, and there is where we take out the stomach. And this procedure utilizes restriction to change the gut hormone that causes hunger and satiety. The expectations is to high amount of excess weight loss, remove portion of stomach with ghrelin, hold less food and decrease the food intake, and minimally invasive laparoscopic surgery. The process can be easily revised if needed in the future to another procedure like the mini bypass, the RNY, duodenal switch. Comparable weight loss to gastric bypass is the same. It's not too much change in with one of the other. No change anatomy and less malabsorption. It means that all your intestinal tract is going to be the same. This is the difference with the RNY or the bypass. We need to make some connections in that kind of procedures. And the recovery time it depends of how soon you need to go back to your work. You can take one week, and or it depends if you make some office. There is a short recovery time. The duration is approximately like 1 hour, 1 hour and a half. It depends of each patient, and the hospital will take 2 nights and recovery 1 to 3 weeks. In this kind of procedure, we use special staplers, and we use a reinforced gastric sleeve surgery to prevent complications like the bleeding, leak, and all that. Next, please. Obviously, this is a restrictive procedure, the gastric sleeve. It means that you're going to eat less portions, but you're going to eat normally. Obviously, you need to continue after the surgery with a nutrition plan and some kind of exercise or activity. You're going to have less hungry. This is because the ghrelin hormone is the hunger hormone. So in the part of the stomach that we take out, there's the ghrelin hormone, so you're going to have less hungry, obviously less satiety, and the gastric emptying is less time to absorb. So it's not going to be to have some too much changes in your intestinal habits. Next, about the endoscopic gastric sleeve surgery. This is a smaller stomach. Is performed by holding the stomach to create a banana-shaped tube. This procedure utilises restriction to limit how much the patient can eat at a time. We put an endoscopic inside in your stomach, and we suture inside with a special device. The expectation is like the previous procedure: hold less food, decrease the food intake, lower amount of excess weight loss, and not well suited for patients with gastrointestinal bleeding, a large hiatal hernia, previous abdominal surgery. The pros can be reversible in a month. Reduce complication rate, and no incision or removing tissue, and there is a short recovery time. The cons: the potential risks of partial openings of the stomach pouch and potential risks of ulcers and bleedings. The duration, it will take 30 minutes, 1 hour, and 1 hospital night, and the recovery is from 1 to 3 weeks. Next, right now, okay, the RNY, or the gastric bypass, or the classic bypass, this was the gold standard, or the first procedure for weight loss. Right now we have a lot of options, but the RNY have a special is for special patients with special characteristics. The gastric bypass surgery performs a new stomach pouch. It means that we're going to leave only the 10% of the stomach. We're going to make a small pouch and make a connection with your small bowel. The small intestine are reroute to bypass food digestion, which create malabsorption and reduce the calorie intake. The expectations are the weight loss, new stomach form to reduce hunger and limit stomach capacity. Did resolve diabetes and hypertension, cholesterol. This procedure is for patients with severe reflux or GERD or heartburn. This is the big difference with the patients who want gastric sleeve, but they suffer from severe reflux, huge hiatal hernia, take all about 40 milligrams or very frequently medication for the reflux or for the heartburn. It will be the best procedure for them. The pros is known as the gold standard for bariatrics, was one of the first procedures for weight loss, and improve obesity-related comorbidities like diabetes, high blood pressure, sleep apnea. And the cons is change of vomit and dumping syndrome and high risk of ulcers. The duration of the RNY on the OR is take like 2 hours, 2.5, and the hospital nights will take like 3 nights, and the recovery is 2 to 4 weeks. All right. What's the best surgery for each patient? It will depend of comorbidities, some medical issues. So the gastric sleeve is the most famous or the most surgery we perform in all the world. For patients, like I already told, with severe reflux or GERD or heartburn, the best choice will be to do suggest a gastric bypass. This is to prevent patient continue with the reflux, because we reroute that acid, bile acid, to prevent the go up to the gastric pouch. And obviously with the gastric sleeve, it will be like a smaller tube, so there will be more pressure inside. So if you suffer from reflux or GERD, this can be worse. So in a future, if you decide of you want, of you need a revision surgery, will be more easy to perform if you have previous gastric sleeve than a RNY, because in the gastric sleeve we don't make any connections. We only remove like the 80% of the stomach, so all your intestinal tract will be in integrity. And that's the difference with when the patient have a previous RNY or bypass and they want a revision surgery. We need to check all that connections that maybe other surgeon make, take some measures, so you have a little more risk. And like I already told you, in the sleep, there's no altering of the anatomy. The difference with the RNY, the anatomy is very altered. Next. All right. In both in the sleeve, gastric sleeve or the gastric bypass, the both of them have the same weight loss, the same resolve of the comorbidities. So it depends. It depends of the procedure. It will depend of what you have a previous surgeries. If you have severe reflux, if you have some comorbidities, that's why it's very important to fill out your HQs, your health questionnaires, so we can check them and suggest what kind of procedure will be the best for you. The mini gastric bypass, like the others, the weight loss will be the same. Here, the only difference is that in the mini bypass, we only make one connection. That's the difference between the RNY or the classic bypass and the mini bypass. The weight loss will be the same, but patients with severe reflux or GERD or heartburn, the best will be to make the RNY, because that other connection we perform there is to prevent that the acid reflux go again up through that stomach pouch. And that's the difference with the mini bypass. If you suffer from that kind of issues, a mini gastric bypass will be a good option for you, because the weight loss will be the same. The duration would take approximately 1 hour and a half, 2 hours, and would take 3 nights, and the recovery 2 for 4 weeks. It resolves to the diabetes, hypertension, reduced calories and nutrient absorb. This is a malabsorptive procedure. This means that you're not going to absorb all the nutrients, and approximately like 2 meters we're going to exclude of your small bowel. So that 2 meters is not going to absorb, is not going to function anymore. So that's why the patient is going to lose some weight. Here, the difference between these two procedures. The most important is to check if there is some marginal ulceration, if patients have previous acid reflux or GERD. The weight loss is going to be the same, and the resolve of the comorbidity is going to be the same. So other important thing here, it's not frequently, but it can be some internal hernia in both of them, and the BMI will be from 35 55 of BMI suggests weight. Okay, the duodenal switch surgery. Obviously, like if you see in this picture, we need to make more changes in the intestinal tract. So the duodenal switch is also known as biliopancreatic diversion with duodenal switch, and it's one of the most powerful weight loss and metabolic surgeries. The we proximally here we need to make like four connections, make remove a part of your stomach, make a connection with your in the small bowel with the gastric pouch. The patient lose 50-80% of excess weight in the first year. High percentage of duodenal switch patients with type 2 diabetes are cured after the surgery. And one of the other thing is the malnutrition is a problem with the duodenal switch, and vitamins must be after surgery. So you will need to be very close with your physician at home to make some checks more frequently than the other procedure um, like the um, gastric sleeve, because with the gastric sleeve uh, you're not going to have problems with the absorption, and this is a difference with the patients with the RNY or duodenal switch. The pros is up of 80% of the excess weight loss in the first year. The stomach size is reduced, high metabolic effect, and highest expected weight loss. And the cons is extremely strict. Vitamins required for life, and it's higher risk than other bariatric procedures, like I already told you, because we need to make it's a bigger surgery. We need to make more connections, so it will take a little higher or risk, and the duration at the OR will take like 3 to 4 hours, and the hospital night like 3 nights, and the recovery 3 to 6 nights. Okay, here at the facilities, we use accredited facilities. Our teams are using standard infection protocols, screening of patients and staff with CT scan, COVID-19 tests, vaccination, antibacterial station available in our facility, fully compliant protection and preventive measures, and do not currently allow visit patients. This is in the worldwide hospitals. So bring or wear your mask. We practice social distancing, test prior to travel, and the vaccination. Very, very important. How fast can patient can return to work after a bariatric surgery? It will depend. It will depend of what do you do. If you depend of an office, you practice home office, or you are outside. If you are sitting, it's an office job. You can take 1 to 2 weeks in the gastric sleeve, the mini bypass or the RNY to 1 to 3 weeks, and duodenal switch 2 to 3 weeks, and gastric balloon 1 week. To stand or walk, it will depend from 2 to 4 weeks, fast pace to 4 weeks, and lifting, we suggest to wait 4 to 8 weeks. It will depend, okay, it will depend.
Thank you so much for taking time explaining all these different procedures. Basically, our packages are extremely affordable, especially with inflation. We haven't raised our prices and tried to keep work harder to make things, still keep it down to the prices we have. However, if you need financial assistance for like loans, there are some companies that you can go with. We do have on our website page for financing, which has links directly going to the places that we work with. Super Money is one, United Medical Credit is another one, e-financing. And basically, they give you access to pretty much all these big lenders like SoFi and Lending Club, Lending Tree. Okay, so we get to the part that we opening up for questions, and so they asked about privacy of when we announce, I guess, the raffle winner. Well, we always have to call the name, so I don't know how else we could do that. So rethink about that. So like I mentioned, if you have submitted your health questionnaire, we could switch you to Dr. Montalvo, and he has to approve you for that procedure so you can take advantage of the $2,000 off. What about the first one? It says, I had gastric sleeve 18 months ago. I lost 18 pounds. Could my thyroid ruin my surgery? And how do you recommend when you fail on sleeve?
Okay, well, obviously, the thyroid is not going to ruin your surgery, because we have a lot of patients who have thyroid issues. So the most important here is to have medical control with your endocrinologist, so they can uh, manage your doses of the thyroid medication, because the thyroid uh, change a lot of things in your body. So you need to be very good under control in that kind of problems with the thyroid. But strictly your surgery is not going to be ruined. Your surgery is going to be there, but you need to take your pills or your medicine and go with your physician so he can take some test and check you. All right.
Okay, so we talked about the cutoff to qualify for surgery with MBC. We have a criteria of BMI of 30. Actually, CDC, after COVID, reduced the requirement down to 35. And if you have comorbidities, I think it's 30 now. So they reduced it. Basically, the criteria for insurance companies is different. To be honest with you, I think that they're trying to perform less of the procedure because it's so costly in US. So they're trying to make less people qualify. But with us, if your BMI is 30, we're not going to give you a runaround. Basically, we evaluate your health questionnaire. We make sure it's a proper procedure. And when you go down there, you still have time to talk to the surgeon and make sure this is the right procedure for you. And then, so that's the difference. Okay. I did gastric sleeve in 2019 and then revision in 21. Can I still do duodenal switch?
Yeah, it's important to fill out your HQ so we can check all that information. But it depends on what kind of a revision they did, and yes, fill the HQ and we can check it.
usually when you get bypass, it's very hard to convert or revise in general. Okay, so this is a good one. What about the violence that has been on the news over there? So I'm gonna start and then Dr. Montalvo can pitch in because he lives in Tijuana. So basically, I think actually what happens is the news is delayed, you know? It's funny how it works. I mean, this was a case, what, about 2 weeks ago, Dr. Montalvo? Or maybe, it was during that festival in Rosarito.
Exactly.
2 weeks.
Yeah.
So,
Yeah.
so about 2 weeks ago, or maybe a little bit more, maybe 20 days ago, there was one day that the cartel were supposed to take over, and that day was pretty quiet in the town. Pretty much businesses closed down, and then they sent the military with air. It was, I don't know how many planes came in to Tijuana.
Yeah, but it was only like like no more than 4 hours, no more than 4 hours that all that uh, people do struggles in the city, but everything was everything was under control. It was during the Rosarito festival, like you already told. But now the next day was everything under control. The city was the city was very calm, and no big deal. But like obviously, like a lot of countries in the world, thing happens, but uh, we are here uh, like 2 or 3 minutes of the border, so it's not, don't be panic, and that only that things only uh, delay the that you come with us to make the procedure. So uh, everything is on the news. So what's
Yeah,
up?
I mean,
Uh-huh.
again, it's got a lot of it's a lot of delays from what happens. I see that because we hear, you know, when the patients call our office to talk to the coordinators, they this again, this was a case like a few weeks ago, and it has totally gone away. So there is no concern right now. A couple of other issues is that you're not alone. First of all, our facilities, our hotel, our operation is in a zone that is right next to the border and is very prominent areas of Tijuana. We're not having a facility in like in the east of Tijuana or on the south going in. So you're in a prominent areas and you're never alone. We pick you up, the drivers pick you up, they take you to the hotel. They pick you up, they take you to the hospital. So you're never alone. And these guys are all local there. They know what's happening. So, you know, I'm not going to say you are, you know, there is no guarantee in life, but as far as the transportation, about the movement in Tijuana, you always in safe areas, you always be safe with being our staff around you. And this thing kind of went away, but I see now the aftermath is like, oh, now people start to hear about it, now start getting worried. This thing is like a few weeks ago, and now people start getting worried about it. So everything is, as a matter of fact, I was crossing the border, was it 2 nights ago? the traffic, Dr. Montalvo, at 7:30, it was so much traffic in Tijuana. It was unbelievable. And I had to wait even with the pass. I was in line at 8 o'clock for, I don't know, 1.5 hours. So the city is back to normal. Everything is back to normal. You know, they pretty much took over the city, the military and the police did. Okay, so do you suggest having the airlines help escort you to the gate if you're traveling alone? Yeah, that could be a good idea. Also, especially when you go back, so you don't get exhausted. So where do we do the surgery? At this point, we're using Me Doctor Hospital. Me Doctor Hospital is very experienced in doing bariatrics. They've been doing it since 2010, if I'm not mistaken. So their staff know how to do the sterilization right. Their ORs are set up right, you know, and that's the most important part, is really the operating rooms. Now we are working our own center that we would go in maybe 3 months, but still, you know, we would use the same, you know, maybe just better rooms, but you know, still have the same quality. So we do have webinars pretty much every month. So it's on our website, advertised every time the date is there, and also you can get email invitation. As we mentioned, our packages for sleep is 3 nights, 4 days after pandemic. So the first night hotel, 2 nights hospital back home. If it's a bypass, it's 4 nights. If it's duodenal switch, it's 4 nights. If it's gastric balloon, it's 2 nights. So the first night you arrive, and then you hospital, and you go. Usually, gastric sleeve is not, you cannot do easily a re-sleeve. Sometimes you can, some occasions or surgeons approve you for re-sleeve, but not all the time. You usually go to mini bypass. So this one is for you, probably, Dr. Montalvo. When I eat dinner, I gain weight. If I don't eat at night, I lose weight. So they said, if I eat dinner, basically I'm gaining weight. Maybe, you know, if you eat late at night, depending
Yeah,
on
it's obviously our eating patterns and this is a nutrition thing. We need to check how many calories they are taking, the hours they used to make the lunch and all that. So obviously, you don't follow a good nutrition plan, good calorie take. This can be these changes.
Is there one procedure that is better for those with severe heartburn? That's a good question in general.
Yes, with severe heartburn, the best will be the R&Y. That we suggest, because the with the sleep, the obviously is going to have more pressure inside of the tube, so the heartburn will be worse. So in this kind of patient, this will be better, the R&Y.
We do have some of our surgeons working on weekends, so you can take advantage of that. What are the 2 types of duodenal switch? So basically, like we mentioned, is a traditional BPD, biliopancreatic diversion with duodenal switch. And there is a single anastomosis, which means instead of two connections, there's only one connection that the surgeon do. The SADI is an easier, less complicated procedure, pretty much have the same results, but the surgeon has to determine which one is better for you. I think they're asking you, Dr. Montalvo, how many revisions of gastric bypass have you done? And how successful they are when they do a revision of a bypass?
Okay, on the revision on bypass, it will depend of the previous, obviously the first surgery, because they take to check everything in that kind of surgeries. They need to check the pouch, need to check the connections, how long are the lengths they live, they put in the previous surgeon. So obviously the revision on R&Y are more complex than if the patient have a gastric sleeve, because the intestinal gut or connections are already altered. So that success will be more, or will be better patients who the intestinal tract are intact than other patients who have the uh, surgery on that connections on the intestinal tract.
Okay, Dr. Montalvo, I can take over if you have to go visit patients.
Okay, thank you.
Now we appreciate
Good luck to everyone on the raffle. All right, see you here. See you soon.
Okay, thank you so much. Appreciate it. Talk to you soon. Okay, so we talked about, this is single incision. Let me go back here. Yeah, okay, so Q&A. Actually, I don't know. This one. So I'm going to include this. So if you have had bypass surgery and you feel like your restriction has gone away, you know, that's the pouch, a small pouch that is your new stomach is probably enlarged. And we could do endoscopically shrink that. And I just put the link in your answer. So we call it TOR, which is endoscopic revision of the gastric bypass, okay? Any procedure you do is you're pretty much going through surgery. So it's not like if you have heart problems, you have to, again, submit the health questionnaire. The surgeon is going to determine what is best for you and if they can perform the surgery or not on your condition. Do they need stress tests for your heart? However they need, they will communicate with you. So usually the boogies or bougie that is used as a guide to cut the stomach in the gastric sleeve, our surgeons are using 34 usually. And there is really not much difference between maybe 32, 34, 36, even 38, but they have experience that this is the best one for them to use. So if you have removed your gallbladder before, it's not going to affect the surgery. Some people do need to remove their gallbladder after sleeve. And there's some that are determined that they need to remove the gallbladder. We could do it when we're doing the other surgeries. So we could include it as an add-on. So why do you get dumping syndrome? Because if you look at the structure of a bypass, you see that the food comes through the esophagus and it gets bypassed down there. It doesn't go through regular stomach with the pyloric valve, so there is no controlling. So if you eat sugar or sugary drinks or whatever, it goes right there and it gives you that shake, that it shakes you up because you get this sugar rush, because you don't have that stomach in place anymore. Gastric sleeve to gastric bypass or mini bypass success is very high. That's a killer revision procedure. Again, when you have GERD or acid reflux, it really depends on what is causing it. If we get overweight and obese, that can cause the reflux by itself. So if that's the cause, the gastric sleeve is going to help you actually with the reflux. If it's coming from because the valve in the top of the stomach is not functioning properly or whatever, that's a different story. Then you probably need to look into bypass. A 4-hour flight back is not actually that much. Again, if you can stay one extra night in the hotel in Tijuana, or make sure you get up and walk around. So this one I've done everything I need except putting my deposit. I had an RNY back in 2004. Is a revision for sure what I need? Again, with the bypass revision, the success rate is not always that good. Again, depends on what is causing it. Is the restriction in the pouch is causing it, or you need more malabsorption component, which means they have to take it down more. Again, you know, depend situation by situation, just rely on your HQ. So we don't require that you be vaccinated. We don't require that you do the test, but we recommend highly at least do the at-home test before you travel for yourself and your companion. This is just one extra measure that you can do to keep yourself and everyone else safe. So after you come back home, really the only thing you have to look into is getting your physician, your general doctor, to do a test on your blood in maybe 3 months to make sure all your vitamins, everything is checking. If you don't have insurance coming back, well, at least you have to have some kind of access to get your blood test done. Okay, so the surgery is going to help you with pregnancy. However, you must wait 1 to 1.5 years before you get pregnant. And it's very important because people who do surgery, they're more prone to get pregnant. So they need to take extra measure not to get pregnant until their body is ready, which is 1.5 years out. So preoperative diet is determined by your BMI. If your BMI is more than 35, you're required to do maybe few days more. Otherwise, if your BMI is close to 30, you just need to do the 2-day clear liquid. If your BMI is higher, then you're required to do more of a pre-op diet. And pre-op diet is very simple. All you do is you take low calorie diet and just take protein shakes, 850 calorie a day, salad with chicken or fish. If you're driving back home, you need to maybe stop every so many hours and walk around. Try to break your days. Maybe stay in a hotel, but don't overdo it, okay? Okay, so our gastric sleeve procedures start at $4,595. That's not including any extras like gallbladder or hiatal hernia repair and all that. This is our standard package. The procedure, however, changes price, depends on which surgeon you go with. Some of our surgeons have been with us longer, so they're a little bit more expensive. For the bypass, it starts at 5,000, I believe, 895. Like I said, the lowest BMI could be 28, 29, depends on your comorbidities. And some of our surgeons take it. Our surgeons do use drain, and that's really good because it shows if you have any bleeding or any leak or anything right away, and it's just another indication and is a safety measure. So some of our surgeons are capped at 3 surgeries per day, some at 4. Depends on the complexity of the procedure. If we put like a duodenal switch, we try not to do so many other ones. If it's all straight up gastric sleeve, maybe 4 a day. Depends on the surgeon. Do you need a passport? Yes, we highly recommend the passport card or a passport book to make sure you cross to US with no delays. Oh yeah, I was going to. So, okay, there we go. I'm just adding the link. I just go back. That was Kelly. Okay, so that one's right here. Okay. So I put the link between SADI and DS differences. Okay, so after COVID, we're not keeping companion at the hospital. They have visitation time, where you go and see your loved ones in the hospital, but we don't allow you to keep the companion. So the companion stays in the hotel while you're in the hospital, and you pay for those extra nights. Yeah, you just contact your coordinator and add your companion, and they make the reservation for hotel. They have all that stuff ready for you when you come. If you have lap band, yeah, sometimes we do refill for the lap band. You know, again, gastric sleeve is a really powerful and good procedure. You don't have to mess around with your intestine. You still have your stomach structure in place. You just have a smaller stomach. However, again, for some people, you really have to do RNY bypass. So if you do sleep and you stay with the diet, what I mean diet means eating healthy and having a healthy lifestyle, which means you be active, you walk, you exercise, you have no problem. You can lose all the weight you want with gastric sleeve. If you have had gastric bypass, you could go to DS, but it's very difficult and sometimes it's not possible. So the best thing to do is just revise the bypass. Depends on whether it needs a tightening of the pouch or you need the more intestinal malabsorption component. We do ESG, but again, that's an endoscopic procedure and is not like sleep, but it is powerful, you know, for lower BMIs like 30 to 34. So your post-op diet is pretty much 4 phases that you do pretty much in 4 weeks. You go from liquid to solid, but you have to transition to puree. So the first week is all clear liquid, and then you go to puree, and then you gradually get to the solid in 4 weeks. We give you all the instructions for how to do this, and we have tapes and videos you can watch. So we have we have 3 doctors that do the DS, Dr. Rodriguez, Dr. Osala, and Dr. Seha, but Dr. Rodriguez has been doing the DS the longest. So the cancellation down there happens, and mainly is like if your hemoglobin level is low, or when they do the test, they find out there is something, you know, major wrong with you. But if you do That's why we recommend you do just a generic blood test before you come. So at least you know your hemoglobin stuff is high. This is especially true for patients who have had sleep, especially bypass, and they're going through revision. Because bypass patients tend to have low hemoglobin. So I would recommend you just get a test for your own safety before you come. Of course, we do our own tests down there, but it just, you know where you're standing. We do not, unfortunately, we cannot take FSA accounts. So we do have, there is a hotel by the airport, Hampton Inn. As a matter of fact, they have special rates for Mexico Bariatric Center patients. Contact Hampton Inn by the airport, the new one. And it's actually a beautiful place. And you can hang out if your times are not matching with what we required. So if you're coming like late at night, just stay in Hampton Inn and then come back to the airport the next day and you get picked up. Or vice versa, which means if you cannot take the flight back on time, just go back to Hampton Inn, stay there one night, and then fly back home. We do paperwork for your time off, yes. Yeah, okay, so that's another good subject. Let me go back and, I mean, we have some success stories I wanted to share with you. Let's see here, quick view, okay, slideshow. And so vitamin and supplements are a huge factor in your success. For sleep, for bypass, for sure, you have to take for years, and duodenal switch even worse. You have to take vitamins and nutritional supplements. We do have emergebariatrics.com that provides top line quality up to the standard of ASMBS vitamins that comes in soft chew, chewable, drinkable, and capsule. And you can order it online. You can do it when you're doing the consent form, you can order it. So there's so many ways, but we do recommend highly for long-term success to do the vitamins. After you go home, if you feel like problems with your surgery, you definitely want to go to the OR and get seen. So there is a leak is the most problematic issue that you may have. So there's a short-term leak and there's a long-term leak. Short-term leak happens right after surgery. That's why we do the leak tests. We do the drain that we put in, but long-term is very rare. After you leave Tijuana, if you don't lift heavy weight, if you don't eat things that you're not supposed to eat, you should not have any problem. But if you feel like there's a problem, I recommend you go right to the emergency. Okay, so Um, I'm just going over to see if there is any questions we didn't answer. There's a lot. So right now we're not that busy. You still have some days that we have openings. It's just a matter of how much of the pre-op diet you need to do. That determines when you can actually get on the calendar. So even if you have filled out a different surgeon, we don't have to switch you because we know from the list that who attended this, if you qualify for surgery for Dr. Montalvo, then we can pretty much switch you then. I do have a list of people who was entered into raffle. And I'm going to be in a minute announcing the winner. Yes, guess who? Yes. Oh, one more question that needs to be, so if you lose weight and you have problem with skin, we have board certified plastic surgeons that can do plastic and skin removal. Our most popular procedure is mommy makeover, but you have to fill out a different questionnaire on mexicocosmeticscenter.com, mexicocosmeticscenter.com, and you go there and you apply for cosmetics. There you go. I put that in there. Our single incision procedures usually for sleeve is about $1,000 more than regular sleeve. Our endo doctor is Dr. Christian Rodriguez Lopez. He's the one doing all the endo procedures. If you're smoking, we recommend highly you keep at least 4 weeks before and after procedure, stop smoking. That's huge. Pre-op diet is very important because it shows how committed you are to the procedure. This procedure is only a tool. Remember, it's a miracle tool. It gives you the capability of losing weight that and keep it off, but you have to work with the tool. You have to adjust to your eating. You have to adjust to your activities. You have to be committed to it. And pre-op diet is a good way to see, like, yes, I'm committed to this. And pre-op diet is another good thing to shrink the liver. That's one of the purposes of pre-op diet. The better you do, the easier surgery it is on you and the surgeon. Okay. Drinking alcohol, we recommend you don't drink alcohol after the procedure. But we see people can have drinks here and there, maybe 5-6 months out from gastric sleeve. For bypass, again, you may get dumping syndrome because of the sugar in the alcohol. Now, when you do the health questionnaire, make sure you list all the medications you take, all the allergies you have. And our surgeon liaison and the doctor is going to recommend or not recommend, require you to stop certain medication or continue certain medication. Bring all your medications that you're taking with you to Mexico, to Tijuana or Guadalajara, whichever you go, including the bottle. It's very important to have that with the bottle when you come there. Of course, you're only taking the ones that the doctor allowed you to take, but bring them all with you, okay? So I have the winner of our raffle, Mahogany Coleman. Let me see if you have, uh-oh. Let's see her. Mahogany Coleman is the winner of the webinar. Please contact us. Contact me or contact your coordinator to get you set up for the $2,000 off of raffle. Thank you so much for everyone attending. I hope that we were at least try to answer questions, and we see you next time. Thank you so much. Bye-bye. Take care.